Awesome. Well, we are here live in Mars. No, not yet. Vegas. And we are super excited. This is Planetary Health First, Mars Next. I'm Michael. I'm the host. And we got Nate here. And what's really cool about this is probably a term I have never heard of. We're going to talk about direct to patient. So what does that mean, Nate? We got Suzy. We got Alyssa.
Go.
So what I'm excited about is healthcare companies have been trying to go to patients and been playing on this theme of consumerization healthcare for years. And let's say 5 years ago, everyone was talking about patient centricity. Everyone just kind of paid lip service to it. Yeah. I would argue it largely failed because patients don't generally pay for healthcare. Yeah. And so patient centricity as a term has been fading out. It was always on the table to really activate the patients in a more meaningful way. And I've experienced building out digital platforms, so literally like websites where patients go to in order to acquire healthcare products. Is that like a
portal?
Not necessarily, not necessarily a portal. I think that's a really good question though, because I think people often say portal, but you go to portal and you have a lot of choice. Yeah, I think of it more as a funnel. Okay. How do I get someone activated and pull them further down the funnel? But this is something that works really well. Healthcare isn't particularly good at it, but all of a sudden this year, Lilly Direct came out and everybody's talking about how they go direct to patient. And we're just in a totally different place where everybody's trying to follow what Lilly's doing right now. And really, it's a reaction to the consumer demand for GLP-1. So I'm excited that consumers are forcing healthcare to change.
And I'm just going to interrupt one second. Are we going to change to patient to person? I mean, that seems like can we not be a patient? You know, I don't know. Anyway, that's a risk.
I am very mindful of when I use the term patient or when I use the term consumer in terms of what I'm actually talking about. If I'm talking about a feature or I'm talking about something clinical. But you do have to think about them interchangeably.
Yeah, and that's a good differentiator. So is anybody using the term like B2P now? Is that going to be the new
D2P? Yes. No, I have many slides with D2P and
I love it.
Yeah, but I think it's interesting to me that the big change here is there's been a lot, like I said, where you engage. We say like, I have a Facebook ad, then I've got a website you go to, and then, hey, call your doctor.
Yeah.
What was on the table for years was actually adding telehealth into that workflow, right? And we know that the companies like Roe and Hims and whatnot have had meaningful success doing this. Most of the pharma manufacturers were hesitant to do this. There was a notion that from a compliance perspective, that this wasn't necessarily okay, even though I would argue the lines of compliance weren't bright. There was a long sort of gray blur of what's okay. GLP-1s, there's so much consumer demand. Lilly said, all right, we're going to do this, right? And now seeing a lot of pharma companies stepping up and trying to do this as well. And similarly, you see medtech companies doing this. You see provider companies thinking about how they treat their patients as consumers and building out this workflow. Cool. So I'm just really excited about what's going to happen.
So I find this fascinating, right? Because as a physician, my whole world clinically is like direct to patient. Like that is a world in which I live. So this notion that there's more going directly to the patients, in theory, I love because they get more access to care. But then there's a question, okay, are we sidestepping physicians and nurses to do that? Like, how do we do that in a way that we just ensure that the quality of care with the technologies or with the drugs is still where it needs to be? And maybe you mentioned telehealth. So I do think that might be one of the ways that we can make sure everybody's playing nicely together. But what are some of your thoughts on that?
I actually think of it more as empowering motivated patients to move further along in their care journey. So one of the first one that I got involved with, we were working with patients who were older and were engaging with their cardiologists, and they were often at a point where they were getting stopped between the general cardiologist moving to an interventionalist. And all we did was we gave them a discussion guide so they could have a more informed discussion. And that was meaningful enough that they were then getting a referral, which wasn't happening otherwise. So it moved them to a new stage of their care journey that wouldn't have been possible before. And we can get into all the various incentives of why they weren't moving forward, but they are real. We can all acknowledge that, clinical care is not perfect when mediated by physicians. It is certainly not. I think there are wide bands of those care journeys.
And physicians also don't, in fairness, know what technology is out there, right? So it takes people connecting the dots to actually say, okay, here's a technology you can use on your journey with your care team to actually start to see improvements.
One of my big learnings too, you mentioned portal. I think the mindset in healthcare is often portal awareness education, which is a very top of funnel engagement.
Yes.
I'm going to feed people more information. I'm going to blast ads on the Super Bowl.
They read it.
I'm going to do something. I sort of looked through some of my early learnings here, totally reframed it. I don't like going top of funnel. I like finding who's motivated to take action, and I want to give them an action. I don't want to give them 8 actions and then lose them in that decision process. I want to give them 1 action and pull them further down.
I love what you're saying by what I think is brilliant design, like iPhone, Steve Jobs, In-N-Out burgers, really. I mean, it's so refreshing. I hate going to the shoe store to have 1,000 shoes. So that's what I'm hearing. Can you elaborate, maybe?
Yeah, and I think, you know, I used to do survey work with this guy. I'll shout him out, John Larson. Love John. And he would do this work on customer loyalty. He's a big fan of the 5-point satisfaction scale. And so usually you get this bell curve and there's a lot of 3s, right? So most people look at it and they say, okay, there's so much money in the 3s. How do I get my 3s? And the problem is if you try to tune your product to the 3s, you lose your 5s.
Yeah.
So he's been able to correlate that if you focus on dragging your 4 to your 5, you drive growth. If you focus on your 3, you can be value destroying. And like that, it's a simple thing. And it's just totally reframed how I think about it. So in healthcare, I look at the motivated people.
Okay.
If I think about a market, it's not who's clinically indicated, it's who's clinically indicated and motivated. And build your digital product for that piece, which might not be everyone.
So what I'm hearing is almost like going back to the 1997 Bezos shareholders letters, the customer delight, really just driving that as your market.
Yeah. And I mean, little things can make a huge difference. I mean, we've seen examples where all we did was design changes, starting with a web-based, like literally desktop, then moved to mobile, moving boxes around, like a little picture here, there. We saw an almost 5x improvement from our first test to our final product. Not 5%, 5x.
Yeah, that's amazing.
All of that cascades through to value on the other side.
Wow.
Yeah.
It'd be crazy. And that's just design. Like nothing
that
changed.
Is why Instagram and Facebook, I mean, I hate to say it, they're getting this real-time, whatever AI, like just multiples of experience and acceleration of their product feedback.
Well, they're acting on the data. I think a huge aspect of this is you need to track the data. So a lot of people, you can build the thing, but you're not tracking the data. Tracking the data costs money. I need to set it up. I need to pay for the cloud. I need to have someone actually look at the data. But then once I have the data, I also need to have a team, which is more than one person. I need design, engineering. I need my marketing person. Like you need a minimum of like a 5-person functionally, because those are different heads. And those people have to respond quickly. The problem in healthcare is that those response cycle times are often 3-6 months or longer.
Way too long.
And they should be on a 2-week sprint cycle. Right? And then you get the growth.
Yeah, so it's not a data problem, right? It's an access data problem, or what you do with the data. It's like making it actionable. Like there's
getting
amounts of data.
4 months after they leave the hospital.
Exactly, it's like not
actionable.
Right.
So I love that you brought up the GLP-1s because everybody knows they're a craze right now. But one of the things I hadn't really thought about until we started talking is that I really do think that they're influencing a big market change. And I have just noticed in the past like couple of months, more startups that I'm meeting that are going direct to patient or direct to consumer first. And I hadn't seen that trend. And I think you're right. I think it's leading that charge.
Well, and building off that, one of the things I'm starting to get more and more intrigued by and excited about is the cash pay market, actually. So we're seeing a lot. I think people refer to it as, concierge medicine. There's sort of big raises on the, with functional medicine. There's this cool clinic near me in LA that opened that's like gym, spa, clinic, lab, just kind of doing everything. But I'm really starting to get bullish on this. And I went really deep this summer on value-based care, thinking value-based care was the answer for digital health. And my conclusion was that it was not the answer. My conclusion was that it is effectively, payers offloading the risk to providers on, 12 months contract cycles. And if I'm looking for more preventative care, which a lot of digital health enables, that cycle time is going to be longer. One. And that 2, I'm starting to think that primary care fits more of a prescription or a subscription model in that way. Insurance pays for something when it goes wrong. But I need primary care all the time. And so my mindset is starting to shift where cash pay could actually really engage in some of these.
I like that. I mean, I think even when you think about like hormone replacement therapy, there are a ton of businesses that are doing that. Consumer cash pay. So I think there's a lot of, and when you look at like the aesthetics business as well, that's well they've been doing for a very long time. And I think if people are willing to pay for that, they're willing to pay for things that are going to make them feel better or feel healthier.
Absolutely. And I think, the hormone replacement is a really interesting one because that's one where there's there's a lot going on in menopause right now in terms of like PR.
It's huge.
Because the medical infrastructure really hasn't, taken that as a medical problem. So it's gone through, and again, we're seeing consumer demand really driving clinical change.
And nothing against women. Men have issues too. Men's health too. I mean, the whole other cycle.
Hey, we want you to have problems like that,
I mean, those clinics are popping up too.
Yeah.
A little more of a Wild West and less of a clinical tone to those.
So I wish we could I feel like we could create a whole series today.
I think there needs to be a Nate next.
I like it.
Let's do it.
Direct-to-patient healthcare.
Yeah.
It's a whole topic we could talk about forever.
I don't know. Is this an innovation lab? Are we creating spin-offs as we talk?
Sure,
I don't know.
we should be.
As long as we follow through on those spin-offs.
Exactly.
Keep spinning things off.
Do more talk left. They're kind of coming from me, but
So I guess we're gonna have to land the lunar or whatever today, right? So Nate,
thank you.
Awesome to
Thanks
have
for the
you on.
opportunity.
Yeah, this is great. Thank you so much.
Thanks so much. Appreciate it.